Thank you. The Cabinet Secretary has now arrived, so we'd like to welcome Jeane Freeman, please. Come up to the front.
Good morning, everybody. It's a particular pleasure, actually, to be here, but also to be in Golden Jubilee. And I'm delighted that you are using this public sector conference centre. My thanks to you for the opportunity to be here, and I was fortunate enough to be here in time to hear some of your last debate, which was very interesting. So I've been the Cabinet Secretary for Health and Sport for 5 months now. And when the First Minister asked me to take on that role, I was very well aware of the responsibility that it carries. We are rightly proud of Scotland's health service, but it is a health service that touches every person, every community, every family at some point in every single one of our lives. So it is a health service that matters to every single person across Scotland. And at the heart of that health service, at the heart of every community, are Scotland's GPs, you and your teams, committed, I know, day in and day out to improving the health of the people of Scotland. The vast majority of people in Scotland will have no contact with the health service other than through their GP. They may, at the very start of our lives, we do have some contact with another part of the health service, but very few of us are going to remember that. And we may have some contact towards the end of our life with other parts of our health service. But the core, the route into it, the means by which we form an impression of what our health service is like, comes from our contact with our general practitioner and that general practitioner's team. So I want to take this opportunity, before I say anything else, to genuinely thank you, both personally and as your Cabinet Secretary, for the work that you do every single day, for that commitment, for that compassion, for that care, and for that consistent drive over decades to improve our health service and what you can offer. And I want you to assure you that one of my most important responsibilities in this job is to make sure that our GPs, Scotland's GPs, can continue to meet the commitment that you give to us every single day. The new GP contract has been in place for 8 months now. As Andrew Bewes has set out, it is a contract that asks you as a profession to step into a new role. In truth, it's a role that you have always taken, but in some ways it's a role that has been little recognised. For me, you are never, ever just a GP. You are exactly what we want you to be and recognise in that contract: the expert medical generalist, the clinical leader in that local community. The contract asks you to step up and lead, both nationally and locally. It asks you to move beyond the traditional boundaries that are set by your patient list. And it asks you to collaborate with partners in wider local systems to improve general practice and primary care and to make a substantial contribution to the health of our population. Whether it's through GP clusters or through the work with health and social care partnerships, you have responded to that call for leadership, and I'm grateful to you for that. As I said, we call the role of the future GP, well, it's actually your role right now in Scotland, the expert medical generalist. It's not an abstract idea. It means simply being the clinical leaders in the community. It means involving GPs in redesigning and reforming health and social care in Scotland. We need to make sure that the generalist clinical voice is heard in those conversations that have all too often focused on hospital services. We need the generalist voice because the demand for services is growing, but the nature of that demand is changing. People are living longer lives, in some cases healthier lives, but not enough healthier lives. Living longer is unequivocally a good thing, but the expectations of people are changing too. and I'm going to come back and say a bit more about that later on. It's clear that we're going to require more generalist care in every community in Scotland, from the most remote and rural to the most urban. The new GP contract, our commitment to 800 additional GPs, our commitment to enhanced integrated GP teams are all intended to ensure that we can meet the challenges ahead. Now, we listened to GPs when negotiating that contract, and I hope that you can see in the contract and in the Memorandum of Understanding that we did listen and we paid attention to what people were saying to us. And I want at this point to echo Andrew's acknowledgement of the role of Alan McDivitt and indeed of Andrew himself and the BMA negotiating team in how we were able to work together to shape the future of general practice in Scotland. A future that is not just sustainable, but one where general practice thrives. I want to say something about where we are now, and then something about how that future vision is shaping up, both for health and social care as a whole, and in terms of the next phase of the GMS contract. So where are we now? We continue to work together nationally and locally to implement the contract. It's not always easy, and we don't always agree. Sometimes we don't agree amongst ourselves. You know better than me that general practice is a broad church. But here in Scotland, we have established a relationship of strong mutual respect and a culture of open and honest conversations between government and GPs. A relationship and a culture which I firmly believe is vital to the future shape of our health service, to the quality of care that we can give to people across Scotland, and one that I'm absolutely committed to nurturing and sustaining for as long as I am in this post. Andrew said that he expects the government to be crystal clear about our commitment to implementing the contract. So let me be crystal clear and reaffirm my commitment to the contract, to the Memorandum of Understanding that is critical to its implementation. The contract and the Memorandum of Understanding must be implemented and must be realised. The commitment to general practice and to the new GP contract is a commitment that goes beyond this government. There is a clear consensus in Parliament, that place where consensus is not too often found. But there is a clear consensus in our Parliament that we must support general practice. Of course, different parties take different views, but the core of that support and that commitment, that consensus, is important. I know that you have some concerns. I heard a few of them earlier that I've heard before. I want to assure you that I am listening and that I hear you. The contract has my absolute commitment. A Memorandum of Understanding has my absolute commitment. The work is underway to deliver for our part what that means. But it is not the end in itself. It is the means towards an end. And as we implement that contract, that relationship, those conversations have to continue. I see from the agenda and from some of what I've heard already that you'll be debating some of those issues and concerns later today. I'm sorry that I can't stay to listen to all the debates, but my colleagues from Scottish Government are here that you will know well, and they will be making sure that I am kept up to date on what has been said and what has been raised. And I'll be speaking, of course, directly to Andrew, his team, and to many of you in the months ahead. Where I can, I want to offer you reassurance. Where you remain unconvinced, you should continue to challenge, and we should continue to debate and discuss those issues. You have stepped up nationally and are rightly influencing the future of how we deliver care in our communities. And you have undoubtedly stepped up locally. We have primary care improvement plans covering every community in Scotland, and every single one of them has been developed in partnership with GPs. These plans, of course, are just the beginning of the conversation, not the end, and we have a distance still to go. And I recognise that that demand of you, that demand to step up and lead, takes energy, takes courage, and takes time. And I also recognise that your time is a very precious resource. And that is why implementing the Memorandum of Understanding through building enhanced multidisciplinary teams is so important. The motions on your agenda today recognise this. They recognise the role of a wide range of professionals, pharmacists, nurses, physiotherapists, mental health professionals and others who can play an increasing role in the GP-led teams in our communities. They cannot work in isolation, just as you can't, undoubtedly just as I can't. These teams need your skills and your clinical leadership. And I believe that you need these teams to free up your time for the care that only you can give your patients. We need you involved because you ask the right questions, you provoke the right discussions, you challenge at the right moments, and you have local and clinical knowledge and expertise that is frankly second to none. So you ask things like, will this actually help my patients and my community? Is this really good value for money? Will this make my GP role more sustainable, focused where I can really make a difference? This is the part of the reform that I'm most excited and enthusiastic about because I see its potential to improve outcomes for people. As last year's contract offer made clear, you need support to realise this potential. Stable income, reduced workload and reduced risk. That's why we're putting £30 million into GP premises. All GPs in Scotland who own their premises are welcome to apply for the new GP premises loan scheme. It is a real innovation and the first scheme of its kind. It's the direct result of close joint working between GPs, government and partners. The first round opened on the 8th of November. It closes soon, but there will be further opportunities to apply in 2019 and in the years ahead. There's other risks too that GPs I know have raised, and those are the risks associated with handling sensitive data. And there's a concern on your part. The effects of GDPR adds to those risks, and I know you're discussing that later today. So I'm really pleased this morning to tell you that health boards will provide the data protection officers needed for general practice, and that will be provided at no cost to GPs. A sustainable... Some people have said that was a small thing. I know from letters I've received, conversations I've had, it's not a small thing. It's a part of showing that we are determined to meet our part of this contract. We ask you to be clinical leaders in your community. We have to help de-risk some of the concerns that you have and give you the resources and the tools that you need to do that. It's an 8-month-old contract. We have a long way to go. But in partnership, I am absolutely certain we will get there. A sustainable general practice with a strong workforce will need more GPs to join it. We have committed to increase the number of GPs by at least 800 over the next 10 years, and we're on track to do that. We're looking at a range of ways by which we can increase medical training, by which we can, with the new ScotGem course, introduce postgraduate medical training focused particularly on GP practice in the remote and rural. We're looking at a range of measures by which we can widen access to medical training in our schools and get the status for that expert medical generalist inside those medical schools and in that training that is so very much needed. We're making substantial progress across the whole GP career pathway, from the education all the way through to retirement. Between 2016 and 2021, the Scottish Government will have increased the annual intake of medical places in Scottish universities by 22%, taking us from 848 to 1,038. And as I mentioned earlier, in September this year, I launched ScotGem, Scotland's first postgraduate entry medical degree course programme, hosted by St Andrews and Dundee medical schools. The first cohort of 55 students have now started. One of the elements of the course is it attracts more mature students, and it does, as I've said, feature an emphasis on general practice and rural medicine. It also carries with it a new proposition I'm very keen to see how this works out. And that is a proposition that in return for a bursary, those students, if they are successful and graduate, commit to working for the health service in Scotland for a fixed period of time. I am very keen to see how that works, because it is an idea that I think is worth looking at as we go into the future and as we confront both workforce challenges and undoubtedly the additional workforce challenges that Brexit, by whichever deal is negotiated, presents us. We've committed to continuing GPST bursaries again this year and already seeing hard-to-fill posts being filled as a result of that £20,000 bursary. We're actively working on increasing the quantity and quality of undergraduate placements in primary care and reviewing how more money for training medical students can flow into primary care. But we need to retain as well as recruit if we are to deliver our commitment to increase the number of GPs. And I share Andrew's concern about the well-being of the GP profession. The demands on you are considerable. In the primary care workforce plan, we said we'd put in place a range of measures that responded to what you've told us. Since the summer, a range of new national initiatives have been launched and are already providing benefits to GPs. The demand for these has been remarkable. We've already extended the places available in the new coaching and mentoring schemes to meet the demand. There is significant interest in new support programmes for GPs in their first 5 years after qualification, support for GPs in doing their appraisals, and a staying in practice scheme. Simple, practical steps to provide support, and we're always open to hearing other ideas about what more could be done. Let me, before I conclude, turn a little towards where I think we are heading, something about the next steps in the journey that we have to take together. Given the scale and the breadth of the actions I've already mentioned, it might be a surprise to hear that we have plans to do more, but we do need to go further. We need always to be thinking across traditional boundaries and always be thinking across the whole system. One of the areas that I want to encourage in every part of my portfolio is that we think about the whole system, whether that is in acute or secondary care, whether it is in primary care, whether it is in health and social care partnerships. We need to have that whole system thinking always as part of what guides us. As Andrew has outlined, we need to work together to set out our plans for new infrastructure, digital and physical. We've set out a hugely ambitious digital strategy for health and care. It starts with the new GP IT system, but where will it go next? A great many of the digital developments on the horizon will, I'm sure, transform clinical practice. And GPs have been centrally involved in shaping that future and must continue to have that central role. Andrew is also right to ask about the future of our physical infrastructure. I've touched a little on some of how we want to de-risk those issues, but we need long-term plans for investment in community health facilities. And I expect to see the initial plans set out in the first NHS Capital Investment Strategy, which will be presented to the Parliament in March next year. We will also turn our attention soon to shaping the next phase of the GMS contract. We published our intentions for a phase 2 a year ago and are beginning to gather the data and the evidence on income and expenses. It will take time and it will need some careful consideration. And I do not want there to be uncertainty while this consideration takes place. The guarantees of phase 1 are and will remain in place. I won't allow general practice in any part of Scotland to be destabilised now or in the future. Let me be absolutely clear, there can be no acceptable phase 2 proposal that creates widespread instability. The reason is very simple. The people of Scotland need general practice. They look to general practice. They need access to their GPs and their teams for them and for their families. Let me say a little more about engaging the public, something here about people whose lives we are here to serve. Primary care and general practice is changing, and we need to take people with us. In my speech to the RCGP conference recently, I said that we needed to stop talking down general practice. I said that you are never, ever just a GP. I believe that absolutely firmly. I believed it before I had this role, and I believe it even more now in this role. And patients, as they become accustomed to new models of care, will see that primary care and even general practice isn't just about the GP. That's a gain, it's not a loss. We need to work together to get that message across. It's how we sustain the core values of generalism for future generations. Humane, compassionate care from cradle to grave. We must continue and accelerate the journey we've been on for many years now, from GPs alone to GP-led teams providing the care. It will take the continuation of open and honest conversations between us, with patients, and conversations always based on mutual respect. That's what we mean by realistic medicine. It is the primary reason to build a multidisciplinary team so that patients can see the right person at the right time for the care that they need in their community. It will not be a GP in every case, although GPs will always be there if a patient needs to see one, especially if they're unwell and don't know why or have more complex needs. You and your practice teams are expert at leading this conversation with patients. You're trusted. But of course, you will require our support to do that. It's a conversation that requires both local and national leadership. I'm not talking here about a one-off ad campaign that wins the ad company awards. Ad campaigns like that don't reach the people we need them to reach, and they don't reach them in a way that is sustainable, where the messages are heard and are imbued. I'm talking about positive, open conversations with people about changing clinical models and why they need not be feared. Some of you will have seen this week in the Scotsman the first of what will be a twice-monthly column from our Chief Medical Officer. In that, she will look to use that opportunity to lay some of the groundwork for some of those conversations. It's a small thing, but that and a range of other measures that we can use, some of which I've already seen in GP practices I've visited, some of which I know you will want to suggest, will help us over time reshape people's vision and view and expectation of what they can get from that primary healthcare team and where they go in order to get it. So, in finishing, let me say my thanks once again to all of you. We need to maintain the momentum, we need leadership, we need engagement. Implementing this contract and doing it well can't be optional. Genuine involvement of GPs in that can't be optional either. Bringing people with us and doing it together is an absolute must. I don't take your leadership in creating all of this for granted. I see your leadership now in developing plans, and I am unashamed in asking you for more leadership, for continued leadership as we build that future. Because only with the genuine involvement of GPs will we improve care for everyone, everywhere in Scotland. Thank you very much.
Has anyone got any questions for Jeane Freeman?
Haven't you got any ideas how I can get rid of this cold? I'm not going near my GP, trust me, I'm not. I'm about to go to a pharmacy in Kilwinning, actually. See if they've got anything helpful they can give.
I'm Vijay Sinthali, I'm from Lanarkshire. Our problem in Lanarkshire is local authorities, when they give planning permission for building new areas, new developments or care homes, they never ever look at the local healthcare provision because by legislation they don't have to. And number of care homes cropping up in Lanarkshire, they're really seriously destabilizing practices locally. Is there anything which can be done about this?
Okay, that's really interesting question and very timely, because there is right this moment going through the Scottish Parliament a planning bill that's looking at what the arrangements are nationally and locally to improve planning decisions and bring our planning legislation more to what we need now and what we are going to need in the future. So having raised that with me, then I am going to speak to the Minister concerned, who's Kevin Stewart is his name, and ask him to show me where in what's in the new legislation, not yet agreed, so there's time still to make changes if we need to, that takes account of local planning decisions, taking a wider account about what is available in a community. Because when local government, local authority planning committees make decisions, they can put requirements on those who are seeking permission. One of the requirements that probably we best know is if there is a big supermarket wanting to be built or whatever, then there will be requirements on the company, the developer, to contribute towards road improvements, for example. So I will raise that directly with Kevin next week and see what we can do. And if you're happy, through Andrew, get that information back to yourselves to see if it's already in the bill, it may be, and if not, can we add something like that that helps into the legislation. Can I just ask, is that a pretty common? Yes. Okay. Right then.
Have one at the back.
Hi, my name is Mark Story from Glasgow LMC. We are encouraging our receptionists to try and encourage people to signpost the most appropriate service. We've just started, and our expert receptionists are trying very hard. I got some messages to look at my social media, and I had a look at the Community Council website, and the outrage amongst our community about how dare our receptionists ask what's wrong with the patient. They know best, they want to see the GP. Your offer of an advertising campaign that was very glossy and won awards would be fantastic, rather than maybe some articles that very small amounts of the population read. I think we do need a national advertising campaign about the change in general practice. It'd be great if it could happen very quickly, because I think almost every cluster is looking at this. How do we tell our population about these changes most effectively?
Okay, that's a very fair point. And when I was dismissive of the glossy advertising campaign, I wasn't implying that we would just kind of leave it up to you. What was in my head, I don't know, you're all far too young to remember one of our early ad campaigns about 5 a day. Does anybody remember that? Does anybody remember the builder? Remarkably good-looking builder, I have to say, very fit and very tidy and clean, who was walking down the road with a banana to his ear, which was a pretend phone. And I just thought, well, that's going to have absolutely no impact on anybody other than perhaps looking at the good-looking builder. So that was what was in my head when I said a glossy advertising campaign. It did win awards, that one, actually, but it had absolutely no impact on people eating 5 fruit and veg a day at all. So there are a range of different things we can do, though. I saw in one of the GP practices I visited some really interesting leaflets that they'd produced. They'd got people involved in handing them out. But it was a small community, so it was relatively easy in one wee high street with shops and so on to do that. That was part of how they began the conversations with their patients. They'd done, I also, as you'd done in terms of the receptionist role and a degree of additional training for receptionists and so on to help them do that. So I think there is something that we can do as government that uses local radio, local newspapers. They still exist. They still tend to be the papers that people keep in the house for a week, between one week and the next, and to look at some other issues using social media. One of the interesting things that's emerging, I'm not sure, we're doing a bit of work to investigate if this impression is actually backed by evidence, but it appears that younger people are going to A&E for things that they should be going to their GP, thinking that will be quicker, when actually if they went to the pharmacist it'd be even quicker, and they're not appropriate in A&E. But it is that they use apps and all the rest of it to do these things. So we're having a good look at what are the range of different tools that we can use that begin to help shift the ground towards pointing people in the right direction when the GP practice is not appropriate. But that also has to back up what you're doing and what others I know are doing in their own practices, about thinking about how they have the conversations with their patients in order to help them get to the right place for the care that they need and free you. So that also is about conversations about, you know, why it would be appropriate for it to be the pharmacy service based in the practice that is the most appropriate person to be talking to, or the physio or whatever. And I'm also aware that there are issues around making sure that we are recruiting and training the numbers that are needed to meet those parts of the contract too. One more, and then I'm sorry, I have to go to that pharmacy.
Andrew Thompson.
Andrew Thompson, Tayside LMC. Firstly, thank you. Thank you very much for your very clear and very a huge commitment to primary care, to general practice, and to the GP contract. My question revolves around realistic medicine. We all recognise that resources within healthcare are finite, and that we have to spend that resource in the best way possible.
Yeah.
We need to use evidence-based medicine to deliver the healthcare for our patients that our patients need, and sometimes not deliver what they might want. General practice does, always has done, and will continue to play its part in delivering realistic medicine and delivering those conversations to our patients. But the doctor-patient relationship is a critical relationship, and it's a longitudinal relationship. And it's no good a GP having a conversation with a patient about something that may not be able to be delivered locally, just to have a politician coming along and saying, no, actually, my constituent should get this service. So actually, my question to you is, will you have our backs? Will you ensure that the whole system lines up behind us to deliver realistic medicine, so that actually we're not undermined at the coalface, and more importantly, our relationship with our patients is not undermined by contradictions through that service?
It's a very good question, and thank you for asking it, and thank you for asking it because it was in everybody else's head as well. And the answer to that is yes, I do have your back. Now, I can't control what every politician in Scotland does. I mean, I would if I could, trust me. And I've just come from an interview with Good Morning Scotland, where I was dealing with an opposition politician's claim that the situation with flu vaccines in Scotland meant that people would die. Now, that is preposterous. Preposterous language, deeply unhelpful, and I have no hesitation in calling it out for what it is. But politics is politics, and I can't prevent opposition parties doing the job that they're there to do. If we were in opposition, I'd be doing the same, which is challenging government, criticising government, looking to suggest alternatives. But what I can do, and have been trying to do, and I'll keep on trying to do it, is say, can we also have a mature conversation about this? Can we actually grow up a bit and talk properly about healthcare and provision and what needs to happen, whilst at the same time we can have arguments and disagreements? Now, we've managed it in other areas of business. We managed it in social security and continue to do that. And I think we can do it here, but it will be a constant. But what I can say is I am going to absolutely, totally support realistic medicine. What's in this contract and this idea of whole system thinking. And some at times, then we're going to get absolute pelters for that. And we just have to take it on the chin, because I believe that what we're doing collectively here is absolutely the right thing. So I'll do my best. Thank you very much. Thank you.